I was involved in this surgery. It wasn't my surgery, not the first time I've been in theatre, but it's definitely one that I won't forget. Let's call the patient Simon. And the reason why he needed surgery that day is because he needed his toes amputated as a result of poorly managed diabetes. Unfortunately, sometimes that could be a complication. Just want to get a show of hands here. If any of you were diagnosed with type 2 diabetes by your GP, who think they would end up with having a limb amputated? Okay, we've got one. That's one more than I thought. I was hoping for no one because, thankfully, that is not the norm. We don't usually end up with having people losing their limbs as a result of type 2 diabetes. Chronic conditions like type 2 diabetes is a very well understood and managed conditions. We can quite often comfortably manage it with just diet and medications. So it got me thinking. I then wanted to speak to Simon at length to find out what went wrong. Was it because it didn't get spotted early enough? Was it because he wasn't given the right medical treatment? Or was it he wasn't followed up? Just hold that thought for now. We've got access to one of the most highly regarded healthcare systems in the world. We've got some phenomenal doctors, I would say that myself, and nurses and allied health professionals delivering some really, really clinically proven treatments, advanced treatments that many people can only dream of. And all of that is free at the point of delivery. Something that I think we take for granted until you go abroad, when you try and access other healthcare systems in abroad. Then you realize what we're actually very, very fortunate. And don't just take my word for it. £190 billion was spent on health in 2024. To put that into perspective, if each and single one of us in the UK, that's 68 million people, were given a share of that money, would all be walking away with almost £3,000. That's a lot of money. So how is it possible that with all of that resources, all of that money, have we still failed patients like Simon? The problem is, chronic health conditions like diabetes is not as simple as that. It takes years to develop, and although you can argue that there's a genetic factor in there, much of it comes from diet and lifestyle factors. And that's not my invitation to tell you to start passing judgment on why Simon did what he did and what he eats what he did. But something to wake us up how wealth inequality will lead to catastrophic, life-changing events like it did for Simon, because losing his toes was just the beginning. He then subsequently went on and had a second operation where his whole foot was amputated. And across the ward where he was going to stay after the surgery, there were many patients who lose the whole limb. As a medical student, I'm very privileged to be able to access, to be able to see how health impacts people. But even more so, as an ambulance co-responder, I get to peek inside people's home outside of the hospital environment. We actually see where they're living, how their living conditions impact their health. And a lot of the time, I get really upset because I can only do so much in front of me. I can only treat the medical conditions that I can treat. And then I have to take them home. Well, I don't physically take them home, but send them home, and then they have to go back to the same problems that led them to that health condition in the first place. Anyone want to hazard a guess how many people in the UK is currently in poverty? I'll give you a hint, it's in the millions. 10 million is not a bad guess, thank you. So 14.4 million people, according to the Joseph Rowntree Foundations. That's more than 1 in 5 individuals that are in poverty. It's not just the amount of people that is alarming, but also how deep into poverty you can see. On this graph here, it shows you the different level of poverty that you can go into. I didn't even know it's classified that. You can go from poverty into deep poverty, into very deep poverty, which some people call as destitution. And this figure is only getting worse year by year. The reason why I'm talking to you today is I want you to understand how when people are in financial difficulties, they will have little to no choice but make what some people in the comfort of their own home can say about bad lifestyle choices. These choices are not made because the people want to make them, but because they've got no choice. In Simon's case, he was brought up in a family where both his parents were working long hours on a low-paid job. That meant they didn't have much time to spend with Simon, helping him with his homework or taking him to after-school club. They were also very limited in terms of where they were living, so they were living in a relatively deprived area. They then had to limit choices of school. Their education is impacted. He wasn't brought up with a very well-nutritious or balanced diet either. All of those factors now come together to create Simon's conditions, where he's now working unpredictable shifts, often working overtime, and diabetes, although it is easily managed by medications, needs to have a good routine where people need to be eating at a regular time so they can then take their medications around their meal times. That was not an option for Simon. He had to eat when he can and often forget to eat because he's working so hard, and you can't blame him to forget to take his own medication as well. The lack of routine really had an impact on him, and on top of all of that, he then also didn't have the means, the time, or the opportunity to access exercise or leisure activities. That then led to him having really poor mental health. He was always stressed. He was anxious about whether he was going to make the ends meet because he would get a different amount of paid every single week. All of that really compounded his conditions. So I'm clearly not a financial advisor, so I can't tell you how we're going to fix Simon's conditions. But I think there are a couple of ideas I'd like to share with you that's worth thinking about. It comes as no surprise to us that most of people's income goes towards housing costs. That is the biggest cost, especially if you come from a lower income background and in a private rented sector. People spend over a third of their income on housing costs. And that really flags up the need for more social housing, because if you manage to get into social housing, you'll be paying 50% of the market rent. All that money that can go towards better food, better access to health, better access to exercise. Also, rather than just blindly building more homes as the government is trying to tell us that they're going to do, we need to have these council flats. Flats are much better use of space than houses, because if we don't take advantage of the vertical space, we're struggling to get land, to find land to develop. We really need to think a little bit outside the box and build up. Not only are we going to be able to build more houses cheaper, faster, we're also going to get better facilities, lifts for people who have mobility issues. All of that is going to then help tackle the problem. There's a massive caveat to that. We also need to make sure these houses remain in state ownership. Right to buy is a great scheme to help social mobility. However, as ownership of properties go back into private ownership, we just go back to square one where we started. We can't allow that to keep going on. However, a different model, like a share ownership scheme, is much more preferred because it meant people have better security of their home, and they will also have a better vested interest to look after it. On the same diagram, you see the next biggest outgoing for people is transport. Let's have a show of hands. Who came here by public transport today? That's not bad, but we do have a slightly skewed population with students. But according to the data about the transport in the UK, only 7% of journeys are made in public transport. And that number is skewed by the fact that 46% people in London commute using public transport. So outside London, it's a much lower figure. And we all know why that is, because public transport is not reliable, it's not flexible, and it often is quite expensive as well. And that's something that we really need to address. We should be able to get from A to B, get to work, get to hospital, without having to rely on cars or other means. That's what we need to focus on, investing in our public transport. Not only are we going to make it more affordable for people, but also that we're going to help with our carbon footprint as well. So hopefully, I've given you some thoughts on why, by keep throwing more and more money at the NHS in isolation, that's not going to help solve the health crisis that we're facing at the moment. Also understanding how people might be making what we describe as unwise decisions, but if you actually take the time to look into their life, you understand why having wealth inequality will drive all these problems. I'm giving you a couple of options and ideas of what we need to be thinking about and how we're going to try and tackle this. Because unless we close the wealth gap, we can't tackle the health gap. Thank you.